And also we think of it kind of like an ongoing trial and error. So we do things based on what we see, and if a person's getting better, we're in the right direction. If not, then we continue to look for other things. But it is a little different scenario than this one. So this is probably 80 or 90%, but 10 or 20% are the bow-legged.
So to see you, to make an appointment, you need a script first from your doctor?
For Medicare, yeah. And if you have
And
a,
if it's not Medicare? If it's just insurance?
what insurance?
It's kind of United Healthcare.
Yeah, that's, the only one we don't take is Cigna. And United is, I don't think you even need a prescription. I mean, we'll see you without a prescription for United. They never ask
So you don't need a
us.
script except for Medicare?
If you have an HMO, like Tufts HMO or Harvard Pill, Tufts or Blue Cross HMO, then you need a referral.
Okay, thank you.
Ken is our expert on that. You could always call the office and he'll tell you.
I was just, this is just me, I was just wondering, in your office, does the physical therapist actually work with you the entire time you're there? Or are you passed off to somebody else, or do they call across to you from the room, wait a minute, look, you like a little high, or?
That's a great question.
Yeah,
That's a great question. Answer is no, I think. So it's Maggie, me, and Gina, and we don't have any aides or assistants. Gina and I, again, both 20 to 25 years. Dr. Curtis, 5 years. And we see people for 40 minutes at a time, one-on-one. So you'd only see us. Once in a while, because of scheduling problem or something like that, you might see me and then see Maggie or something like that. But that can be avoided. If you really want to stick with Maggie, for example, you could just see Maggie 40 minutes. You typically do twice a week. We typically do like 2 or 3 weeks twice a week, and then once a week for. So in the initial part, we're doing things with our hands, and we want to see how people react. So we tend to do things, see people twice a week. And then after 2 or 3 weeks, people are doing a lot better, like John is. And so then we continue once a week for maybe 2 or 3 or 4 more weeks, and adding exercises and continuing to monitor and make adjustments and tweaking things. So we average about 8 appointments per person.
Thanks.
Are you and Maggie medical doctors or PhDs in?
Doctorate in physical therapy, DPT. Be like like an attorney or a chiropractor or all those type of. It's not a MD, yeah. And not a PhD either. 1 second, I think.
Hi, how do you differentiate between referred back pain and knee pain?
What was the second thing?
Knee pain.
Yeah.
Referred back pain and knee pain.
So it's a bunch of questions, and then treating it and seeing how a person reacts. So it's not easy to do in general terms, be like, so for example, if a person has pain going upstairs and they don't have pain at other times, it's probably their knee. But if they have pain like standing still, then it's probably coming from their back.
Or potentially both.
Or it can be both, yeah. Sometimes when there's problems in the knee, thank you, it gets kind of swollen and tight in the back of the knee, and that can put pressure on the sciatic nerve. And so it can cause sciatic problems, sciatic pain, sciatic irritation, but it's really from the tightness in the back of the knee. It can also be a combination of both, low back and knee.
So what kind of doctor would I go to differentiate?
Probably an orthopedic doctor.
One more question?
Sure.
How do you feel about acupuncture in addition to PT?
I think of it when somebody is like really stressed, when there's a lot going on. and when there are multiple joints and things like that, and somebody's been in pain for a long time, and there just it seems like stress is part of the issue. Now, I'm kind of agnostic about it. It may work a lot more frequently than I think of it for.
Yeah.
But I just think I can solve it, and then if I can't solve it, then I start thinking of other things. That's just how I kind of approach it. Did-
Yeah, where do things like cortisone shots come into the whole trying to hold off on surgery?
Yeah, I would think of it if PT doesn't work. Because, like the injections that John was getting, they're benign. I don't think they do any damage. But the cortisone injections soften, they're not good for the joint. They soften the soft tissue. You know, they'll say we can't do more than 4 of these per year. Well, if they can't do more than 4, then 1 is probably not great either, you know. And it may be like, maybe you need it, you know, if a person's going on a trip to Europe and their knee really hurts, I would say get it so that your trip isn't spoiled. But if you have the time to try and solve it in other ways, or another scenario would be like you're gonna have a knee replacement in 3 months and it really hurts, I would get the injection because it's gonna be replaced anyway. Now talk to your doctor, because sometimes it has a certain amount of time has to go by before they'll do surgery after a cortisone injection.
How do you feel about CBD oil treatment?
Again, I'm not agnostic about it as well. And I usually hear about things when they fail, because that's how they end up in PT. So the 2 or 3 people who have told me have said it hasn't helped, but I also know anecdotally from like friends and things like that, that there are a lot of people who really like it. So from what little I know, I would say it's something to explore. I met the woman who owns the new store in Needham, and she seems very knowledgeable and very service-oriented and very eager to help people. So I think she'd be a good person to talk to.
I was jogging around Devasio Park a few years ago, and a coach, not my coach, but a coach who was coaching another man, he said to me, "Your knee is only good for 40 years. Well, sure enough, after 40 years, I started having knee pain. Is that true?
It's like the 94-year-old who goes to the doctor and says, "Doc, my knee hurts," and the doctor says, "What do you expect? You're 94." He says, "Well, my other knee is 94 and it doesn't hurt." I've been running 40 years, and so far so good. Maybe this is my year to have problems, but
Thank you.
I think.
I can attest that a system similar to this worked for me. About 10, 12 years ago, I had a knee that felt like it was bone on bone. Okay, this is after the injury already occurred. And I was in such agony that I went to see the orthopedic surgeon to have the knee worked on. Well, for some reason or other, after all the tests, he suggested that I go through physical therapy for it. And I think I probably went for about twice a week for maybe 8 weeks, to physical therapy. Now this is approximately 12 years ago. I still have the knee and it's pain-free.
Wow, that's awesome.
Sometimes it works. This is gonna work all the time,
Right.
but sometimes it does. And this was for physical therapy right here at the hospital in Needham.
That's great.
So, and this was an orthopedic surgeon that recommended that approach first. You could always go back and have the surgery.
Exactly.
But if
And-
you can avoid it,
Right. And the worst case scenario is if the PT doesn't work and you need the surgery, you're gonna have a better surgery having done the PT first.
their approach was to strengthen the muscles around the knee. And of course, it gets that down to the hip and the ankle as well.
Right.
So it's a very similar approach. And, you know, they had me climbing steps and everything doing this therapy.
That's great, yeah. Yeah, use it or lose it is one of my favorite expressions. And I think we tend to think of our body like it's a car, like the more we use it, the worse it's going to get. But our body's the opposite. That the more we use it, generally the better. We do have to make sure we don't kind of cross that line as far as what our body can handle. But doing things and then gradually doing more and more things.
So I know this isn't really your thing, but you're probably knowledgeable. So there's cortisone shots, which you can only do a certain number a year. Are there other kinds of injections?
Well, John you want to talk about yours?
You know, the thing that I had, I think I've had maybe 3 or 4 times. It's called Synvisc 1, and that's the trade name for it, but there's about 12 different versions of the same thing. And what it is, it's essentially created from the combs of roosters, if you can imagine. And it creates a fluid called hyaluronic, if I'm pronouncing that correctly, hyaluronic fluid, which they inject into the knee. And it's a big long needle, and it goes way in, and it's really interesting to watch if you don't mind. But so I had it done in the orthopedic surgeon in Edmonton Wellesley Hospital, and that was before my latest visit with Jim. And so what it does is that you don't feel the results immediately, but you feel it within a couple of days, and it lasts for 3 or 4 months, where it essentially takes the pain away. It did. For some reason, this practice at New Wellesley switched from Synvisc 1 to a competing fluid, and they said it was an insurance issue. Now, I've got Medicare and Blue Cross Federal, so I don't know, what that was all about. The new one, as far as I can tell, works not at all. So, they only can give it to you every, I think it's 4 or 6 months, I think, maybe 6 months. So you get it in, let's say I got it in, most recent one was in October, and by November it was useless, essentially. So and as I say, there are 12 different formulations. And, one may work a lot better than another, but in my case, Synvisc worked, and the other one didn't, so that's what it was.
But if they only let you do it twice a year or something, is that because it can be dangerous?
I don't know what the reason is for that.
No, I don't think so.
I don't have any answer.
Thank you so much.
Do you have any suggestions for non-opioid medications for pain release?
PTs, we stay away from medication. We stay away from giving advice on it. So, like over-the-counter things, I think chondroitin. I think there used to be glucosamine and chondroitin, where I think one of them is no longer in favor. I think one of them is. I think it's chondroitin that is considered to be helpful. I know that they're both extremely benign. I think there's never been any adverse effects from glucosamine and chondroitin. The idea is that they're a component of what our cartilage is made up of, and so they help to rebuild the cartilage.
I could say something about that. I was probably for the last year or so taking about 2,000 milligrams of acetaminophen every day because of the pain in my knee, and that's not probably very good for you, taking all that, but it hurt. Ever since I went back to see Jim, I stopped the acetaminophen. I mean, I don't need it anymore. So,
And those are not good for the liver, and anti-inflammatory is not good for the stomach, and opiates not good at all. All right, I think we'll wrap it up unless there's any other questions. So thank you very much.
Thank you.